Hi everyone, my name is Dr. Rebecca Brown and I work at Balance Regenerative Medicine in Brooklyn. And today we're going to talk about platelet-rich plasma, which is otherwise known as PRP. Now, PRP is a process by which patients' blood is concentrated, and these very powerful growth hormones within the platelets are used to heal chronic tissue injury. In sports medicine, PRP can be used to heal many soft tissue injuries, including tendonitis, sprains, meniscus, ACL injuries, some mild forms of arthritis, and multiple other issues. PRP can also be used for hair loss, to accelerate wound care, and it's the main ingredient of the aesthetic procedures that we do here called the vampire facelift, the vampire facial, and the vampire breast lift. In the realm of sexual health, PRP is used for sexual regenerative treatments such as the P shot and the O shot. So platelets contain proteins, which are called growth factors, and PRP magnifies this healing action of your blood, the normal healing action of your blood, by increasing the production of collagen, stimulating new blood flow. So PRP harnesses this normal regenerative capability of the platelets and amplifies these natural growth factors so that your body can heal faster. PRP is processed on the same day that a patient comes in for injection. So when a patient comes into the office for their procedure, we first draw their blood and we centrifuge it in this centrifuge machine. This particular machine has been FDA approved to process PRP injections, and it has been shown to increase the platelet count by up to 6 to 11 times, depending on the quality of your platelets. We first spin, we separate the red blood cells from the plasma, and then we take the remaining plasma and we centrifuge it again to concentrate and extract the platelets. And we now have our concentrated PRP and we're ready to do your injection. And we just do your planned injection, which shouldn't take more than 15 or 20 minutes now that the PRP is prepared. So in the first few days after your injection, you may feel some increased inflammation or swelling. This is absolutely normal, and it should all resolve after the first few days. The intensity becomes less each day, the intensity of that inflammation, and you'll notice gradual improvement over the next several weeks following your PRP therapy as your body actually begins to heal. So some patients report ongoing improvement in their injuries up to 6-9 months later after PRP therapy is administered. There have been multiple studies using ultrasound and MRI images of musculoskeletal tissue, and these have shown that there is definitive tissue repair after PRP therapy. Shows visible proof of the healing process. The beautiful thing about PRP is that we can treat injured tissue before the damage progresses, reversing it, so surgical intervention may not be needed. So remember, you should not treat your pain with any anti-inflammatories or NSAIDs for 2 weeks prior to a PRP injection and for at least 3 weeks after a PRP injection, as we are trying to induce inflammation and initiate a healing cascade in the tissue. Taking anti-inflammatories or NSAIDs will blunt the effect of the PRP and negate all of the benefits we are trying to get, so just avoid them. You should also come to your appointment well hydrated so that we have no difficulty taking your blood sample. Again, if you are having increased inflammation after your PRP injection, this means that the PRP is working, and we have other ways to address your pain or discomfort besides anti-inflammatories. And aside from some increased inflammation, the side effects in PRP are very limited because since the injections are created from your own blood, your body will not reject or react negatively to them. So we are just enhancing and guiding your body's natural healing process. So thanks for listening. I'd love to talk to you more about any questions you might have. And if you think we can help you or you know of someone else who we might be able to help, please pass our number along. Thank you.